So hi everyone, thanks for coming, and thanks also to HACA for inviting me to present today. I'm James Lewis, and the head of the Geospatial team at the UK Health Security Agency, or UKHSA. And it's a little bit of a different presentation from Rich's. I'm not going to talk about a specific piece of analysis, but I am going to talk about what we're doing and some work we're doing at the UKHSA to build a better geospatial function to support analysis, ultimately to improve public health outcomes. So I'm going to talk a little bit about UKHSA. We're a relatively new organisation since October 2021, and we're an executive agency of the HSC. I'm then going to focus on some work we've been doing to transform geospatial, and then at the end I'll give some examples about how that's feeding in to enhanced analysis around geospatial and some of the projects we're involved in. Oh, hello. Not quite sure what that is. Okay, I think that's formatted a shape in quite an odd way. I'll carry on. There's an image behind that odd shape. I wasn't quite sure what to call this. It's a chronology, a history, but my daughter went to see Taylor Swift recently, so it's a kind of an eras tour of public health transformation over the last few years. So I'm going to go back to 2007. It's when I first joined, and I first started working in public health. We were the Health Protection Agency, which is what you can just about see under that shape. And GIS had a dedicated team at that point, been in place for about 3 or 4 years, supporting microbial risk assessment, but wider use of geospatial and GIS, and also starting to look at providing centralised and enterprise capability across the organisation. There you go. Not sure what happened there. Let's see what excitement's happening on the next one. So we got involved in H1N1 in 2009, so we provided response to that incident. And then in 2013, you can see that, the Health Protection Agency, cancer registries and public health observatories came together to form Public Health England. And there was a real drive at that point to push forward with an enterprise approach to geospatial and a centralised approach to geospatial. So we created the first GIS strategy aligned with ICT, and we also started a procurement exercise for an enterprise license agreement with ESRI, really with a view to being able to provide centralised data and centralised platforms for analysts and research and analytics. As Public Health England, we got involved in the Ebola response in 2018, but then fast forward to 2020, we started the pandemic and responding to the pandemic as Public Health England, quite a small team, a team of 4, but some really some notable outputs and products supported by the team, based on the approach that we'd taken, that we had data and we had platforms in place to be able to respond. So at the request of from the Secretary of State for Health at the time, we were responsible for the first public dashboard for COVID-19. It was only in place for about 2 months, and it was replaced by the data.gov integrated dashboard. But another piece of work that I'm really proud of, and it's been talked about a few times. Andy Boyd mentioned UPRN this morning. We had address validation in place pre-COVID. We had address-based premium, we had address validation tools, but it had been quite a challenge to apply that to public health and see the subsequent sort of analysis that came from that. For COVID-19, it took a sort of step forward. We were working with epidemiologists who saw the value of standardized address information in the COVID data. So a daily routine of automated validation and manual checking was spun up, and we actually continue that today as automated pipelines into continued COVID-19 surveillance. The outputs of that, not only geospatial, we were creating lots of internal web applications to provide local health protection teams with a sort of cartographic representation of the clusters, and specifically what cluster and what properties those clusters were happening, care homes, prisons, etc. And it was also feeding aggregated cluster detection reports to health protection teams. At the time for COVID-19, so there were two other organisations that were created to support the response. So the Joint Biosecurity Centre was an added data function capability created by Cabinet Office, and NHS Test and Trace, that was the sort of test and trace function for the response. And then fast forward to 2021, Public Health England, Joint Biosecurity Centre and Test and Trace came together to form the UK Health Security Agency. So what do we do? So our mission, I'm not going to go through all of this, but I'm just going to talk about the mission to prepare, prevent and respond to health threats that impact on population health. Our key goals are around preparation, so being ready for and preventing future health security hazards, responding, saving lives and reducing harm through effective health security response. And one that's perhaps most pertinent to this presentation is about building, strengthening the public health capability, and specifically the geospatial public health capability to meet the strategic priority that you can see around improving action on public health through data and insight. So as an organisation, we've got various groups, which are ExCo member-led, Director General-led. We have science, clinical public health, health protection ops, and data analytics and surveillance, which is the group that my team sits in. What you can see on screen are the directorates. It's quite a complicated hierarchy, so apologies if it's confusing. But what you can see on screen are the various directorates that form DAS, the data analytics and surveillance capability. So we have analytics and data science, which is where I sit, all hazards intelligence, data and cyber, and data operations. And I'm not going to focus too much on all of these, but really the work I've been leading is around objective of DAS's objectives, namely number 2, leading a data transformation. So building and developing capability around geospatial and integrate geospatial into common workflows, reproducible pipelines, etc. And ultimately that's to inform enhanced surveillance, but also to improve our public health impact and supporting policy. So why are we transforming data? So geospatial. So like I said, it's been quite a turbulent few years, not only, well, as for everyone in the room, not only because of COVID, but also because of the sort of significant organisational change we've gone through. But actually that was an opportunity as we came into UKHSA to learn the lessons from COVID and actually build bottom up. So my kind of vision is to build on the work we've always done, an enterprise approach to geospatial, but to make that more efficient, make it more standardised, and ultimately make it sustainable. And align that with UKHSA strategic priorities that I've already spoken about. And I think one of the key points here about why we're doing it is because the data analytics surveillance group that we sit in was the JBC, the Joint Biosecurity Centre. So I've moved my team from one area of the organisation into the data capability to leverage the new opportunities we have as a data function. So working more closely with data engineering, with data products, etc. So that was a real opportunity for us, and that was something I thought we had to kind of jump on as we came into the organisation. So how we did that, we worked closely with Ordnance Survey. So I got in contact with Ordnance Survey late 2021 into early 2022. And at the time, they were supporting cadres into government organisations funded by Geospatial Commission. And we saw it as an opportunity to sort of temperature check where geospatial was and ultimately define a programme and a strategy for developing and transforming geospatial. So it's known as the UKHSA Geospatial Unified Approach. We didn't call it a strategy at the time because as a new organisation there were lots of strategies. So we docked in closely with the UKHSA data strategy and called it a unified approach. And there are 3 functional areas that this defined. One around building better platforms and data engineering. The second around creating standardised reproducible products. And the third one, which is sort of, again, most pertinent to this presentation, is about developing a capability around analytics and research, and some of that enhanced analytics and research that previously we've not been as close to. So again, it was an opportunity to bring in dedicated resource to support that. So as a result, this was all happening at the same time, but we've now grown from a team of 4 to a team of 11. We have dedicated geospatial data engineering roles, geospatial products, and also geospatial analytics research and insight, Gary. And then we wrap those in something new, a UKHSA geography profession, supporting how we use geography and geospatial across the organisation and outside of the organisation by wrapping it in the standards and governance to provide that standardised approach. And we also have a global public health element to this as well. So we work closely with global operations to support projects that are funded by WHO and FCDO that allow us to support nominated countries to develop their competencies around international health regulation. I'm just going to finish by going through some pieces of work that we're doing across data engineering, products, and then analysis that ultimately are supporting our ability to lead on research, geospatial research and analytics. So for data engineering, there's a lot happening as a new organisation. So we're having to work very closely, and we should work very closely with some of the enterprise data capability that's now within the organisation. So data design and architecture, technology, enterprise data modelling, and specifically reference data management. So I think the key here is that we get the basics right so that we can form improved analytics in the future. We're working on automated pipelines for reference data, primary reference data that we're bringing in from external sources, ONS, OS, for example, but also modelled secondary reference data, so those metrics that can be used across hazards to support surveillance and response. And UPRN again is a key area of our work, so making sure that as an organisation we're using a finer resolution of geography beyond postcode to extract that information about explicitly where people are living, the type of property they're living in, and now some of the metrics coming out from Ordnance Survey around building condition, etc. Just quickly to go through products. So these are perhaps the more traditional pieces of analysis and products that come from a sort of GIS team. But we are now aligning with, again, standardised product delivery across the organisation in our Data Operations Directorate. We do have an enterprise agreement with Esri, and we're managing how to deliver common methods for data access, linkage, and analysis through R and Python. And the key for me there is that we can provide common methods to apply geospatial in non-code and code environments. And we're also supporting a new platform, again, sorry, I said new quite a few times, Enterprise Data and Analytics platform, which is dedicated to analytics but needs to utilise that common reference and authoritative reference data that we're producing, and methods and tools as well. So I'm just going to skip forward. So I'm just going to, for a few minutes, I'm just going to go through some of the analytical projects we've started to sort of lead on. And like I say, this is really a sort of step change for us. So we often supported research in other teams. We often supported analytics in other teams and provided that geospatial expertise. But now we've got dedicated analytics and research capability within the team. And that's really starting to sort of show dividends in terms of involvement in these types of projects. So it's called Gary. It's led by Donna Clark, who came to us from ONS last year. And one of the first projects she was involved in was an E. coli STEC outbreak investigation report. So E. coli STEC, it's a Shigella toxin producing E. coli. It's a foodborne pathogen, and it can find its way from host species, cattle, sheep, into the watercourse, contaminate food products, those contaminated products are eaten and the population is infected. The purpose of the report was to take the epidemiology studies, so the narratives around where people have been, the food they purchased, the sources of the food they purchased, and align that with some environmental data to look at where there are explicit weather events and conditions that had amplified the process of taking, or the pathway from source into to infection. So Donna and colleagues looked at various data sources, including flood data, land cover data, and also weather event data from the Met Office, and correlated that with the narrative coming from the cases, and were able to demonstrate that the use of applied geospatial data, in addition to the qualitative narrative information, could identify the potential sources of these outbreaks. Another piece of work that Donna's working on is around the use of aerial imagery and machine learning and computer vision techniques and modelling to extract information that we don't necessarily have at a national level. So Legionnaires is impacted by it's a bacterial growth, and it can occur in standing water, and then it becomes aerosolized and it can infect humans. The sources can be cooling towers, air conditioning units, fountains, pools, etc. So when there's an outbreak, there are very few cases, but it's really important to find the source of the outbreak very quickly, as I'm sure some of you are aware, so that you can remove the issue at source and then reduce the impact on population health. So cooling tower information is managed. It's managed at a local authority level. So each local authority has a good understanding of their cooling towers in their area, but it's traditionally quite a difficult data set to aggregate at a national level. And that's where machine learning is coming in, some of these techniques around computer vision and unit models. So training the models to take training data about known locations of cooling towers and then extract information based on the characteristics of that training data. So that's something that's we're currently working on, is going to feed into potential future outbreaks and understanding of locations of source. And the next two are around pilots that are being led by the Geospatial Commission. So the first has only just started, so I can't give too much information on this, but I wanted to make you aware we are working on it. It's about making population movement or mobility data accessible across government and start to understand the use cases for that data should it be more accessible in the future. So we're working with colleagues across UKHSA and across government to look at developing those use cases around population movement data, particularly whether we can utilise it for local, national and international transmission of infectious disease, but also potentially looking at it in terms of synthetic populations. And likewise, so the population mobility pilot has just started. The Earth observation data pilot, which some of you may be aware of, has just finished. So it ran from 2023 to 2024. And again, it was looking at the benefits of, and demonstrating the benefits of making Earth observation data readily accessible to government. So Donna's been working with health equity teams to look at how we can use that information, whether it's Pleiades Neo, Spot.io, or Thermal, around how it can improve the metrics that we apply to understanding the location of vulnerable populations and the impact of those vulnerable populations to things like heat or extreme heat or cold events. So the latter being something that we're looking at with health equity and the Ministry of Justice around prison population vulnerability. And then I think finally, I mean, I'm just going to finish by looking at partnerships and collaborations specific to the analytics and the research work we're doing. So there's lots of collaboration that Donna's working on with the Ministry of Justice, with universities, Liverpool, Southampton, around PhD proposals and grant submissions, and also with the British Trust for Ornithology and location of wild bird populations for avian influenza being worked on with the Animal and Plant Health Agency. But I think what's relevant across all the work that we do in geodata engineering, in products and in analysis is that we are an enabling capability. We can't work alone. We need the epidemiologists. We need those subject matter expertise in order to validate our work and give our work purpose. So we collaborate across various teams internally for developing our geo platforms, for example, and also the products we deliver. So in summary, I think this goes back to something that Anita said in the plenary this morning, which I was quite interested in. So one of the challenges we have around developing our analytical and geospatial capability is that we are a new organisation. It's changing. The technologies are changing. The structure of the organisation is changing and adapting. And a challenge for us is that we not only need to react to the tactical requirements being asked of us, but we've got that sort of future, we've got that future vision for how we want geospatial to be, and it's quite a challenging. So I'm keen to get anyone's sort of thoughts and support on how you can transform from status quo to future aspiration, and that is a challenge for us, and doing it in parallel is a challenge for us. But ultimately, the kind of light at the end of the tunnel is that we're seeing a real sea change in how geography and geospatial is viewed. So I thought my microphone went off. Was it cutting me off? No, I've got 2 minutes. Okay. Yeah, we're seeing a real sea change in how geospatial, it's not only viewed within the organisation, but how it's being applied. There's much greater visibility, and ultimately that's meeting our aspiration to use geospatial in a more advanced way to support visualization and analysis for all hazards intelligence, ultimately to improve public health outcomes. So that is my presentation. I don't know if anyone's got any questions.
Cool. A big thank you to James, please. Now, let's see if people have been using Slido. But whilst we're waiting for Slido and my poor eyesight, I know we're all going to ask James which is his favourite Taylor era, or at least his 2 favourite albums. And if they're not Red and 1989, you can just leave now. But are there any questions from the audience whilst I get Slido up? Ah, fantastic. Rich?
Just interested in you saying that in an earlier iteration you were providing like a sort of corporate GIS internally for your analysts. Is that still going on, or what happened to it? If not?
Yeah, it's basically the sort of vision behind what we're doing. I think it's expanded a little bit. So in the past it was around being more of a self-serve capability. I think we're still aiming for that, but also acknowledging that there's more advanced analytics that we can support.
Thank you.
They're not Taylor fans, so we don't care. So, right, very importantly, can we have access to your UPRN-based reference data and indicators?
Well, it depends. So the source of UPRN is accessible to NHS as members of the public sector geospatial agreement. So the 39 million, however, reference points there are in address base is accessible as a data set. And also the tools. I know Jim Lockyer does a lot of work on UPRN in NHS England. So yes, but it's the linkage then, how we use that to link to public health data, to NHS data, and the sharing and governance around that. So I wouldn't be able to answer that directly, but it does come back to a question that was asked around measles. I think you asked a question about measles. So how could we work together more closely so that us with the specificity around location of measles at UPRN level and how that informs work in the NHS, but I think that would be above my...
Is there anyone above your pay grade, James?
No,
Anyway,
there's
but you're the head. There is no one above you on that chart. Anyway, I'm guessing if you've got a question, you can email James. He's got it up there. That's his fault. Anyway, so James, what recommendations would you offer to analytical teams looking to introduce geospatial analysis into their capabilities?
I think it's happening. I think it's happening anyway. People are using it. People are using it in R and Python. I think the challenge is standardizing its use. So UPRN is a good example. There are multiple ways we could reference a UPRN, but even the different access points to address space provide different algorithms to how you might link. So there are various ways it can be adopted. It's not doesn't come without its complexity though.
Thank you. Oh, one more question before